All right, Wish TV medical reporter Dr. Mary Gillis joins us. She does here Monday through Friday. Good to see you again. Happy Monday to you.
Yeah, happy Monday.
All right, there's some new treatment that might be available right now that's the FDA just quickly approved. So that's some good news, at least as far as this coronavirus.
Yeah, isn't it? Mike, we can't always, it's not always good news that we have to report. But
right.
this is good news, right? Like we were talking about in the previous segment, or you guys were talking about in the previous segment, the FDA emergency approval, tens of thousands of this drug is going to be shipped out, and then there's going to be sort of a systematic way in which they're going to be doing it. So it's going to be a process, and it's going to go to the most vulnerable populations, and the drug companies donate it to the federal government.
This is the remdesivir?
Remdesivir, yes,
okay.
yes. So, but then also I wanted to talk about a new project that the infectious disease experts of the White House Task Force came together, and they call it Operation Warp Speed.
Okay.
So currently there are 14 clinical trials right now that are undergoing clinical trials. And Dr. Anthony Fauci said, we can't wait to see what happens. We have to start developing vaccines, and if something doesn't work, then we have other things to fall back on. And then I think we talked about this maybe a little bit last week, but there could be different vaccines for different populations, one for children, one for adults. There could be sort of a dose response where some people need less and some people need more. So out of this could become many things. So it has a lot of potential, and just some good news this week, I think.
Yeah, and the vaccination, they're hoping, normally this takes a couple of years, but they're really revving it up here.
Yes, and as Dr. Anthony Fauci said, he said it is possible by the end of this year that this could happen, whether it's remdesivir or whether it's one of these other 14 clinical trials undergoing development. It's just about having, the development, the systematic distribution, and finding out which populations are going to get sort of the first doses.
Yeah, we get back to normal here at some point as well.
Yeah.
Dr. Mary Gillis, thank you so much for joining us. Appreciate it. Let's toss it out to Randy right now.